Ocal-FA is a multivitamin and iron product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and help maintain good health. It is best to take Ocal-FA as directed by your healthcare provider, usually once a day. It is important to take it at the same time each day to maintain a consistent level in your body. Ocal-FA can be taken with or without food, but it is recommended to take it with food to help with absorption. Be sure to follow the dosage instructions provided by your doctor for the best results. When taking Ocal-FA, it's important to follow the dosage instructions provided by your doctor or on the product package. Typically, it's best to take this medication once daily, either on an empty stomach, 1 hour before or 2 hours after meals. Remember to drink a full glass of water with the medication, unless your doctor tells you otherwise. If you experience stomach upset, you can take Ocal-FA with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as it may decrease its effectiveness. After taking the tablets or capsules, make sure not to lie down for at least 10 minutes. If you are taking the delayed-release form or extended-release capsules, make sure to swallow them whole and not crush or chew them. Taking the medication regularly at the same time each day will help you get the most benefit from it. If you're experiencing constipation, diarrhea, or an upset stomach while taking Ocal-FA, don't worry, these effects are usually temporary and may go away as your body gets used to the medication. However, if these effects persist or worsen, it's important to contact your doctor or pharmacist. One thing to note is that iron in Ocal-FA may cause your stools to appear black, but this is not harmful. It's important to remember that if your doctor has prescribed Ocal-FA, they have determined that the benefits outweigh the potential side effects. In fact, many people using this medication do not experience serious side effects. While rare, a very serious allergic reaction to Ocal-FA is possible. If you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of potential side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist. As for the best time to take Ocal-FA, it's typically recommended to follow your doctor's instructions and take it at the same time each day for the best results. And as always, if you have any concerns about the medication, don't hesitate to reach out to your healthcare provider. Iron-containing products, such as Ocal-FA, can be dangerous if taken in large amounts, especially for young children. It's important to keep this medication out of the reach of children to prevent accidental overdose. If an overdose does occur, it's crucial to seek immediate medical help or contact a poison control center. As for the uses of Ocal-FA, it is commonly used to treat or prevent low blood levels of iron and to help maintain healthy levels of calcium and vitamin D in the body. The daily dosage varies depending on individual needs and should be determined by a healthcare professional. It's important to take Ocal-FA as prescribed and at the recommended times for optimal effectiveness. Before taking Ocal-FA, make sure to inform your doctor or pharmacist if you are allergic to any of its ingredients, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist of your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your brand of multivitamin contains folic acid, let your doctor or pharmacist know if you have vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia. Untreated vitamin B12 deficiency may result in serious nerve problems, so it's important to consult your doctor or pharmacist for details. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this medication. It's important to be aware of the potential interactions with other drugs when taking Ocal-FA. This can include a decrease in absorption of certain drugs, such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate the doses of these medications as much as possible from your doses of OCal-FA. Be sure to consult your doctor or pharmacist for guidance on how long to wait between doses and for help finding a dosing schedule that works with all your medications. If your multivitamin also contains folic acid, it's important to inform your doctor or pharmacist if you take certain anti-seizure drugs, such as hydantoins. Additionally, OCal-FA may interfere with certain lab tests, potentially causing false results. It's crucial to make sure that lab personnel and all your doctors are aware that you are taking this medication. If you or someone you know has taken too much OCal-FA and is experiencing severe symptoms like passing out or trouble breathing, it's important to seek emergency medical help by calling 911. Otherwise, contact a poison control center immediately. In the U.S., you can call 1-800-222-1222 for your local poison control center, and in Canada, reach out to your provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Remember, it's always better to be safe than sorry when it comes to medication overdose. If your doctor has prescribed OCal-FA, it's important not to share it with others. Make sure to keep all medical and lab appointments. Some brands of OCal-FA may also contain ingredients like docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to note that OCal-FA is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you are taking OCal-FA on a prescribed schedule and you happen to miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, it's best to just skip the missed dose and take your next dose at the regular time. It's important not to double the dose to catch up. As for the optimal timing, it's best to take OCal-FA as directed by your healthcare provider. Remember to follow their instructions for the best results. It is important to store OCal-FA at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product expires or is no longer needed, be sure to properly discard it. It's best to consult your pharmacist or local waste disposal company for guidance on the correct way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.